Now I will discuss the anatomical features of the posterior cranial fossa, and it is the lowest fossa. This is highest, this is lowest, and this fossa bounded anteriorly by the superior border of the petrous part of temporal bone, and on each side and behind by the transverse sulcus. This is transverse sulcus, and this is the margin of the sulcus which lodges the transverse sinus of this side and this side. So the parts of the posterior cranial fossa, they are lying deep to this boundary. Here you will get the cerebellum, but here you will get the cerebrum, here also cerebrum. This is frontal lobe, this is temporal lobe, and here you will not get the occipital lobe. The occipital lobe is here. Above this transverse sulcus is the occipital lobe of the cerebrum, and below it is the cerebellum, and between this is the tentorium cerebelli, which is extending along the margin of the transverse sulcus and along the upper border of the superior border of the petrous part of temporal bone up to the dorsum coeli or posterior clinoid process. Here is the attachment of tentorium cerebelli. Deep to the or below the tentorium cerebelli, the contents of the posterior cranial fossa are cerebellum, then pons and medulla. Then question is, what are the bones forming the posterior cranial fossa? And the bones are sphenoid bone, anteriorly sphenoid, and among the sphenoid bone, the parts forming the posterior cranial fossa is the dorsum coeli. This is dorsum coeli. Then posterior aspect of the body of the sphenoid. Then posteriorly the occipital bone. The basilar part of the occipital bone is this one, this basilar part, and also the squamous part, and also the condylar part. All the three parts form the parts of the posterior cranial fossa. And on each side, temporal bone. This is temporal bone. So here the some part of the temporal bone forms the part of the posterior cranial fossa. So this part is the temporal bone. So sphenoid, occipital and temporal, these three bones form the posterior cranial fossa. And in this fossa, one big gap is there. It is the largest opening on the base of the skull, and that opening is called foramen magnum. And magnum means large size, and it is about 3.5 into 3 centimeter in dimension, length 3.5 and breadth 3 centimeter, and through which many structures pass. And if I divide this foramen into two compartments, anterior and posterior, and the anterior compartment, that is called osteoligamentous compartment, which is smaller, but the posterior part, a neurovascular compartment which is wider and divided by the alar ligament. Anterior compartment transmits three important structures. One is apical ligament, then upper band of the cruciate ligament, and membrana tectoria. And through the posterior compartment, which is wider here, also called the neurovascular compartment, the structure passing through the neurovascular wider posterior compartments are the lower end of the medulla oblongata with its meninges, fourth part of vertebral artery which is surrounded by the sympathetic plexus of nerves, then spinal root of axis nerve which is coming through this posterior compartment, then passing towards the jugular foramen. Here this is jugular foramen, then posterior spinal artery which are two in number, and anterior spinal artery. So all these are the structures passing through both anterior and posterior compartments of the foramen magnum. The anterior part of the foramen magnum, this one is called the cleavus. If you are asked what is cleavus, it is the cleavus which is formed by the three bones, and it is a sloping surface, and it is formed by the dorsum coeli, this one, dorsum coeli, then posterior part of the sphenoidal body, this one, and then basilar part, this one, of the occipital bone. What are the structures on the posterior surface of the petrous part of temporal bone? Here, because the extension or boundary between the middle and posterior cranial fossa is the superior border of petrous part, so this surface will be included in the posterior cranial fossa. Here you can see one foramen is there, and in this side this foramen, and in the separate temporal bone this foramen. This foramen is called internal acoustic meatus, because this is external acoustic meatus outside, and in the petrous part here internal acoustic meatus. So what are the structures pass through the internal acoustic meatus? Number 1, the facial nerve. Number 2, the vestibulocochlear nerve. And number 3, one artery is the internal auditory artery or labyrinthine artery. Is a branch from the basilar artery. Then come to this foramen here. This foramen is called the jugular foramen on both sides. But this jugular foramen, it is not present in the disarticulated skull. You cannot see jugular foramen in the separate occipital bone, neither in the temporal bone. It is formed when you articulate these two bones, the petrous part of temporal bone and jugular notch of the occipital bone, you will get the jugular foramen in this way. So this is the jugular foramen here. Question is, what are the structures passing through this jugular foramen? Before that, you must know the foramen having 3 compartments: anterior, then intermediate and posterior. In the anterior compartment here, this is the anterior compartment, here you will get the inferior petrogenial sinus. Here this is the position of inferior petrogenial sinus, which is running forwards and drain into the cavernous sinus present on either side of the pituitary fossa. Here, cavernous sinus. So the middle compartment, mainly the nerves are there, only one artery is there. Nerves are 9th, 10th and 11th cranial nerve. That means glossopharyngeal and vagus and accessory nerves. And artery is the meningeal branch of ascending pharyngeal artery. This is the only artery which passes through the middle compartment of the jugular foramen, and one emissary vein. And it is not always present, but sometimes you will get the emissary vein. And through the posterior compartment, the sigmoid sinus becomes internal jugular vein, because this is the transverse sinus, this one, and this transverse sinus, if I draw the right transverse sinus passing through this, in this group in the sigmoid sinus, then it becomes the internal jugular vein. Internal jugular vein is a continuation of the sigmoid sinus here in this way. So right transverse sinus, sigmoid sinus, then to the posterior compartment internal jugular vein. On the left side, the left transverse sinus, then sigmoid sinus, then internal jugular vein. Another foramen we find on each side of the foramen magnum is the anterior condylar canal or hypoglossal canal. Can you see the condylar canal? Yes, this one. And if I take the occipital bone separately, we can see this wire is passed through the hypoglossal canal, this red wire on this side and this blue wire on this side. Both are anterior condylar canal or hypoglossal canal. And through this structure pass mainly the hypoglossal nerve or 12th cranial nerve, and beside this hypoglossal nerve, other structures are meningeal branch of ascending pharyngeal artery and an emissary vein which connects the intracranial basilar venous plexus with the extracranial part of the internal jugular vein. Besides this anterior condylar canal or hypoglossal canal, there may be another canal which is seen from outside. This is called posterior condylar canal, which is above and behind the occipital condyle. This is occipital condyle, above and behind, but this canal is not always present. When present, it transmits the supracondylar vein and meningeal branch of the occipital artery. If you see in this articulated skull, here you can see the posterior condylar canal is here, this one, of this side, but this side there is no canal. You see only the depression here, but this side you see the canal. That means this canal is not always present. So all these are few important structures in the posterior cranial fossa.